Good afternoon, Team St. Clair members. Welcome to day 327 at the EMA office where, as you know, we've been bringing you the fight against the invisible enemy, the COVID virus, here with Chairman Mark Kern. And Chairman, we've got a special guest here today, and we're really looking forward. Remember, the word of the day is patience, so don't get in a hurry.
So we're really fortunate. Major General Richard Neely is here, Adjutant General from the state of Illinois, which makes him the commander of the Air and the Army National Guard, who's making a big difference for us at the St. Clair County Fairgrounds with COVID. Appreciate you being here today.
Well, thank you, and thank you, Chairman. Appreciate the hospitality this afternoon of you and the entire health department. It's great to join you here today. You know, as the commander of the Illinois National Guard, I couldn't be more proud of my soldiers and airmen who continue to assist our communities throughout Illinois. Last year it was a very challenging year for all of us, whether it's here in the state, the nation, really across the world, dealing with this global pandemic. And you know, it's nice. It's really rewarding for us, the National Guard, to be supporting and be able to take part in this new vaccination mission. And we think it's important for us to be able to support our communities. As all of you know, and we discussed earlier today, the National Guard is made up of citizen soldiers and citizen airmen that, you know, their full-time job is working in the community. They you know, live in your neighborhoods. They go to the same schools as in colleges that some of your kids may go to. They go to the same churches and synagogues. But when their nation calls or when the state calls, they respond. And today out at St. Clair County Fairgrounds, you could really see that impact that they're bringing their military skills to support this new vaccination mission that's starting here in St. Clair County. So we're very happy to be part of this larger effort. And you know, supporting the local health departments and being able to be a part of you know, getting to the light at the end of the tunnel, which is coming through this vaccination here, you know, here in this community and across the state.
So let's talk a little about that. So 4 teams here at the St. Clair County Fairgrounds, 2 at the East Side Health District, and yes, I know they're training, I think, today and tomorrow. Talk about your operation through the state. This operation is far bigger than just what we're seeing here.
Right. So this is really our first push outside of Cook County, outside the city of Chicago. We started there based on need and really capacity at the Cook County. And what we really wanted to do is to start small and ensure that the National Guard really was able to build out its teams and really kind of tweak our processes, make sure we were prepared. And so we're happy to be here in St. Clair County, really the next push south out of Chicago, and really start to distribute this capability across the state. And we're going to see more and more of the National Guard moving into other communities across the state. Both, I think we have teams getting ready to stand up in Sangamon County in the near future, down the Carbondale area. More and more are coming online. National Guard, we're working obviously very closely with Illinois Department of Public Health, and they're working closely with each of the local health departments, county health departments, to understand where the need is and where the National Guard capacity, the ability to take on large vaccination missions are. And so that's why we're here and happy to, as this is our next jumping off point to support these missions.
And we appreciate the way you and your troops engage with the community, because there's a lot of people at the fairgrounds, and it's very seamless. No matter who anybody is attached to, they're all pulling in the same direction, and that's because of your leadership, and we sure appreciate it.
Well, our team they're great leaders all the way up and down our organization. You know, that's one thing about the military. You know, our military jobs, whether for the Air Force or the Army, is really trained, you know, to serve overseas and for that national defense mission. But what we do in these cases is we take our unique warfighting skills, our unique abilities that we have being in the military, and some of that's command and control, We organize, take on large logistical missions. And this is a great example of where we're able to do something like that, being able to move into an area and work closely with the community. And I have to tell you, it's really rewarding for our troops to be able to help their communities, knowing that we've had so much hurt across the state, across our nation with this global pandemic. And it's rewarding to be able to come into the community and help out our neighbors as part of the community, and being able to knowing that we're close to seeing the light at the end of the tunnel again to be able to end this global pandemic. So we're excited about being here.
Well, and whether it's a natural disaster, we know we can always, or COVID, we know we can always count on you and your troops. And we sure appreciate all of the work that you've done here and what you've done for St. Clair County. This mass vaccination site would not be if it wasn't for the help from.
Well, and I have to, compliment you and your team, local health department. As we walked around there, I was amazed to see the level of thought put into how we organize, how that was organized. It's really the first drive up location that the National Guard's been involved with in the state of Illinois. And, the thought that went into how do we keep some of those that have less mobility to be able to stay in the vehicle and be able to get their vaccine, or those that might feel more comfortable coming in and sitting down or maybe dropped off on a bus and being able to sit down and get their vaccine. That is very impressive. And so, I'm sure we'll run into some bumps along the way, but we'll work through those, and very positive that, it's going to be a great effort here as we get started. So thank you.
Once again, thank you for being here. We appreciate you
Absolutely.
talking to us. And Herb, you got anything?
General, just, I think the chairman's pretty well said it. I can't thank you enough. Chief Rizzo has been my contact person, and she's always been a phone call away, and that makes it a smooth issue with everything we've got going on. As Chairman said, 327 days we've been here, but to know that I can walk back to the office that she has set up or call her on the phone takes a lot of pressure off of us. So we really appreciate what your men and women are doing for us.
Yeah, we're here 24/7, so let us know if we'll adjust as we need to, and just continue to make things better. And excited that the next thing we need everybody to get out and get their vaccines. Right, as the vaccine becomes available, people need to make sure they get signed up. And as the governor said a few times, if you're not sure how to get on that website, go get your grandchildren, go get somebody that get signed up and get out and get your vaccine.
Well, just so you know, a lot of comments on the live feed here today. Thank you to the National Guard for what you all do. We support you. So, Team St. Clair is just really appreciative to what the National Guard is doing for us.
Well, thank you, and it's an honor to be here again, and it's our community. So we're part of it, and we're excited to help out in a small way to get us all back to normal. So thank you.
Thank you, General. We really appreciate you being here.
Thank you.
Thank you.
Stay safe.
327.
327 days, Herb.
And you were down there another day, a lot of our citizens coming through, getting a thumbs up. So we got a long haul, but we're going to do it. And
All positive. Everyone's being patient, and remember, all these people are here to serve you and to make sure that you get a shot, that you get the vaccine that you need, so we can get through this pandemic together. That's what only way it's going to happen is if we get the appropriate number of people vaccinated, we get immunity in our community, and we can get back to where we were 327 plus days ago.
And now we got to listen to the boss now.
Here we go.
Where's the health department?
Sam Bierman from the Health Department.
Yes. So as of today, we have tested 258,671 St. Clair County residents, which is an increase of 1,002 from yesterday. And we are at 26,299 positive test results, which is an increase of 99 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. And today our daily county positivity rate is 9.9%. And we are at 232,372 negative test results. Unfortunately, we are announcing 4 additional deaths today for St. Clair County, which does bring our total to 423. We had a female in her 70s who did have underlying health conditions, and a male in his 60s a female in her 80s, and a male in his 80s who had unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 24,820. For state totals, 16,258,348 have been tested, with 1,134,231 positive test results, which is an increase of 3,314 from yesterday. And for deaths, the state is reporting 19,375, which is an increase of 69 from yesterday. For hospitalization numbers in St. Clair County, currently we have 78 patients that are admitted due to COVID-related reasons, and 4 of them are on ventilators. Regionally, we have 112 patients that are admitted due to COVID-related reasons, and 7 of them are on ventilators. For our congregate care facilities that are previously or currently in outbreak status, please remember that these numbers are cumulative and we will only announce any facilities that have had changes. Freeburg Care Center has 137 cases and 17 deaths, and that is an increase of 1 death for that facility. And before I turn it over to Chairman Kern for his update, I do have a few updates regarding our mass vaccination site down at the fairgrounds. We do have appointments available the rest of this week for anyone in that 75 and over category. So if you have any questions, please don't hesitate. We have a dedicated call line that you can reach someone and actually speak to someone Monday through Friday from 9 a.m. to 3 p.m. And that number is 825-4447. And during this week, we will be moving into 65 and up. We do not have a definite date set for that yet, but we will be sure to bring you those specific details when we get to that point. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam.
On that number,
Yes,
patience.
yes, yes. Please understand
The
that
call
a
takers are
lot of
overwhelmed.
people are trying to call that line. So if you do receive a busy signal the first time, please try back. And when you do reach someone, please have some patience. As soon as they hang up from one call, they're answering another.
Over
So-
about 3,000 calls in the last 48 hours.
So try to handle online
Yes,
what you can, but if you can't, then call that number by all means, but realize that every call taker, when they take a call, they're spending time with the people calling in, signing them up, and so it does take a while to get through that, but keep trying and have patience. The good news is, with the fairgrounds and the Major General working with us, we have the capacity, and right now, we've got the vaccines, so
We do.
your appointment will be available real soon, so. Thank you, Sam.
absolutely.
All right, we'll move into the zip code report. These are the COVID positive changes in these St. Clair County zip codes. In 62203, we go up 2 today to 573. 62204, down 2 to 362. 62205, up 3 to 604. 62206, up 4 to 1,205. 62207, up 2 to 547. 62208, up 10 to 1,468. 62220, up 10 to 1,850. 62221, up 19 people today to 2,526. 62223, up 7 to 1,564. 62225, up 1 to 129. 62226, up 10 to 2,891. 62239, up 3 to 421. 62240, up 2 to 147. 62243, up 6 to 680. 62254, up 3 to 742. 62257, up 9 to 319. 62258, up 7 to 945. 62260, up 5 to 720. 62264, up 8 to 331. 62269, up 9 to 2,967. And 62285, up 3 to 507. As Sam said, 99 new positives today out of 1,002 tested makes that daily county positivity rate 9.9%, way too high. The 7-day rolling average, though, remains at 7.5% today, and regional positivity remains at 6.5%. That is derived by 2.2% in Bond County, Clinton County 5.8%, Madison 9.4%, Monroe 4.2%, Randolph 3.7%, St. Clair's the second highest today at 12.7%. Washington County beats us by 13.4%. So we got work to do. Let's not rest on our laurels. Let's wear the mask, wash the hands, watch the social distancing, stay out of crowds. Even if you have been inoculated, even if you've gotten the vaccine, you still have to wear a mask because you still may be contagious. And with a good portion of people not getting the vaccine, they still are able to contract this virus. And so we got to remember, let's just keep doing what we're doing, and we'll get this number down in the community, and we'll be able to get back to normal. ICU beds, we were at 20% availability today. That's the second day in a row, and regional positivity remains 6.5%. If we would continue with the 20% availability tomorrow, then that would trigger reopening. But we just will not know about that until tomorrow when it's announced. Hopefully we'll maintain the bed capacity, but we're very close to the edge on both, so we just have to pray and continue to pray that people do what they're asked to do and that we can get rid of this virus. But it was really impressive to have the Major General come and talk to us today, and certainly everyone that's working the fairgrounds is just doing such a tremendous job.
I never like to count our chickens before they hatch, but just remember Super Bowl Sunday coming up. We want everybody to behave, try to enjoy, go out and root on your best team, but we don't want to fall back. We are close, as you said. We need another day on the hospitalization, and then we can open up a little bit more, but we definitely don't want to go back. And we've seen this in the past, the roller coaster of these numbers. So please, everybody, let's just use some common sense, and then we can get this behind us. Don't forget, if you haven't went in and signed up on the EMA page on the farm to fill out showing your interest in getting the vaccine, or on the health department or on the county page, do so. As of today, 63,393 citizens have signed up. That's 1,930 people since yesterday when we announced it. So there's definitely interest out there. You've heard us say patience. Everybody, the call center is doing the best they can. I know sometimes you're calling, the phone is busy, but please understand, as the chairman said, those men and women answering those phones are doing their best. They're trying to help everybody. So a little patience goes a long, long way. The health department, the National Guard, everybody is doing the best to get those needles in everybody's arms that want it. Right now, we've got some vaccine in the county. They've got, Sam said, appointments billed out through the rest of the week. So we're filling them. So if you haven't got that email yet, keep checking your email, check your spam, your junk mail. We've seen some of those situations take place. If you need help, call, and we will get you the help that you need. We're going to continue to do this, and we will see you back here tomorrow for day 328 as we continue to get this invisible enemy under control. Everybody have a good night.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this deadly virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.